Hello, my name is Dr. Francis Opala. I'm the facilitator for this online course. Please pay attention. The topic we are going to discuss is imaging modalities used in radiology. By the end of this lecture, you are expected to be able to understand the meaning of radiology, know the different modalities used in radiology, and know the uses, advantages, and limitations of each modality. Radiology is a medical specialty that uses imaging to diagnose and or treat diseases seen within the body. What are the types of imaging modalities? They include projection radiography, fluoroscopy, computed tomography CT, or computed axial tomography CAT, magnetic resonance imaging MRI, positron emission tomography PET or PET, nuclear medicine, and ultrasound. These are imaging modalities used in radiology. What is projection radiography? This is the type of modality that everybody knows that is commonly called X-ray. They are used to determine the type and extent of fractures, as well as detecting pathological changes in the lungs and other parts of the body, and are still in wide use due to their low cost, high resolution, and depending on the application, lower radiation doses. Projection radiography is the first imaging technique available in modern medicine. Fluoroscopy produces real-time images of internal structures of the body in a similar fashion to radiography, but note, employs a constant input of X-rays at a lower dose and is useful for catheter guidance in conducting some procedures. And what is computed tomography? Also called computed axial tomography. By the way, what is tomography? Tomography is a cross-sectional imaging of an object with a penetrating wave, like X-ray or ultrasound. Once you do a cross-sectional imaging, that is tomography. In CT tomography, a beam of X-ray spins around an object, which in this case is the patient, and is picked up by sensitive radiation detectors after having penetrated the object, which is the patient, from multiple angles. A computer then analyzes the information received from the scanner detectors and constructs a detailed image of the object, that is the patient, and its content, the structures of the body, using mathematical principles laid out in the radial transform. What are the advantages of CT? It is very superior to conventional tomography as it can readily image both soft and hard tissues. One of these disadvantages is a greater ionizing radiation dose burden than projection radiography, for which repeated scans must be limited to avoid health effects. Now, magnetic resonance imaging, MRI. This modality uses powerful magnets to polarize and excite hydrogen nuclei, that is single proteins of water molecules in human tissue, producing a detectable signal which is spatially encoded, resulting in images of the body. It is an important tool in musculoskeletal radiology and neuroradiology. That it can produce images in axial, coronal, sagittal, and multiple oblique planes with equal ease, and gives the best of soft tissue contrast of all the imaging modalities. The disadvantage of MRI, one of them is that the patient has to hold still for long periods of time in a noisy, cramped space while the imaging is performed. And therefore, many of them suffer from claustrophobia, which is an abnormal fear of being in an enclosed or narrow space. And sometimes this claustrophobia may be severe enough to terminate the MRI exam, as reported in up to 5% of patients. Indications of MRI. Due to the powerful magnetic fields and the strong fluctuating radio signals to which the body is exposed, MRI is contraindicated in patients with pacemakers, patients with cochlear implants in the ear, patients with indwelling medication pumps, patients certain types of cerebral aneurysm cases, and patients with fragments in the eyes and some metallic hardware. As we can see, all these contraindications are due to the metallic component of those things that the MRI can magnetize and cause problem in the body. Tomography, PET or PET. This modality allows for 3D mapping of administered positron emitting radiopharmaceuticals, example of which is 18F fluorodeoxyglucose. It enables the study of biologic function in health and disease, in contrast to modalities like CT and the MRI that study mainly morphologic changes. It is commonly used in cancer detection and evaluation of cancer treatment. PET also can be used in conjunction with computed tomography, and in this case it is now called PET-CT, or when it is used in conjunction with magnetic resonance imaging, it is called PET-MRI. Nuclear medicine modality uses small amounts of radioactive tracers, such as technetium 99, metastable technetium 99, iodine 123, iodine 131, gallium 67, indium 111, thallium 201, and 18F fluorodeoxyglucose. It uses them to evaluate various body organs and their functions. It can detect abnormalities, diagnose diseases, and monitor treatment effectiveness. The radiopharmaceutical emits radiation, usually gamma rays, which is detected by a gamma camera that then forms an image based on the pattern of uptake of the radiopharmaceutical in the body. And with computer processing, the information can be displayed as axial, coronal, and sagittal images, and is called single photon emission computed tomography SPECT, or position emission tomography PET. The uses of nuclear medicine include the following. It can be used in displaying physiologic function, of body structures. The heart, the lungs, the thyroid, the liver, the brain, the gallbladder, and bones are commonly evaluated for particular conditions using these techniques. The excretory function of the kidneys, iodine concentrating ability of the thyroid, blood flow to the heart muscle can be measured. And one limitation of nuclear medicine is that anatomical detail is limited. And medical ultrasonography. This modality is well known to most people. I'm sure some of us may have, have a course to go through ultrasound in one way or the other. It uses high-frequency broadband sound waves in the megahertz range that are reflected by body tissues to varying degrees to produce images. It can be used in the fetus in pregnant women, imaging the fetus in pregnant women, abdominal organs, heart, breast, muscles, tendons, arteries, and veins, and so on and so forth. One major limitation of ultrasonography is that it provides less anatomical detail when compared to techniques like CT or MRI. Techniques of ultrasonography include the following. It studies function of the moving structures in real time, emits no ionizing radiation, and contains speckle that can be used in elastography. It is very safe to use and does not appear to cause any adverse effects. In fact, there is no reported adverse effect of ultrasound use so far. It is relatively inexpensive compared to other modalities and quick to perform. Ultrasound scanners can be taken to critically ill patients in intensive care units, avoiding the danger caused while moving the patient to radiology department if assuming he cannot be taken there. So it is highly portable. The real-time imaging of ultrasound, the real-time ability of ultrasound in imaging can be used to guide the drainage and biopsy procedures. Doppler capabilities on modern scanners allow the blood flow in arteries and veins to be assessed. In conclusion, you now know what radiology is, the different radiology modalities, their uses, advantages, and limitations. Thank you, and bye.